What medications are used to treat cluster headaches? If you or someone you know suffers from cluster headaches, you might be curious about the medications available to help manage this intense pain. Let's break down the options for treating cluster headaches, focusing on both abortive and preventive treatments. When a cluster headache strikes, the goal is to stop the attack as quickly as possible. One of the most effective abortive treatments is high-flow oxygen therapy. Breathing 100% oxygen through a face mask at a high flow rate, usually between 7 to 12 liters per minute, can provide relief in about 15 minutes for many people. This method works by constricting blood vessels and blocking pain pathways. Another popular option is triptans, such as sumatriptan. These medications act as selective serotonin receptor agonists, helping to reduce inflammation and constrict blood vessels in the brain. Sumatriptan can be administered as a subcutaneous injection or nasal spray, often relieving pain within 15 minutes. Octreotide is another injectable medication that can help stop headache pain by modulating the releases of neuropeptides. For those who prefer a nasal treatment, lidocaine nasal drops can be applied to numb the nerve endings and relieving severe headache pain. It is important to note that over-the-counter pain relievers like aspirin, acetaminophen, or ibuprofen are generally not effective for cluster headaches due to the extreme severity of the pain. Now, let's talk about preventive treatments. Verapamil is the most commonly used medication for preventing cluster headaches. This calcium channel blocker relaxes blood vessels and stabilizes nerve activity. It is effective for both episodic and chronic cluster headaches, but it requires careful monitoring due to potential heart-related side effects. Lithium is often prescribed for chronic cluster headaches as it helps regulate neurotransmitter activity and may reduce the frequency of attacks. Corticosteroids, such as prednisone or methylprednisolone, are used as short-term treatments to quickly reduce attacks at the start of a cluster period. These steroids help reduce inflammation and swelling. Ergotamine can also be used at bedtime to prevent overnight headaches by constricting blood vessels. Additionally, some anticonvulsants like gabapentin and topiramate may be used as adjunct preventive treatments, although the evidence supporting their effectiveness is less robust. In some cases, occipital nerve blocks with corticosteroids and local anesthetics can provide relief by interrupting the nerve signals that contribute to headache generation. When using preventive medications, it is essential to take them daily during a cluster cycle, even on days without headaches, to maintain their effectiveness. For abortive treatments like oxygen and triptans, starting them as soon as an attack begins is key for the best results. Combining treatments may be necessary for optimal control, but this should always be done under medical supervision. Remember that some preventive drugs requiring monitoring for side effects, such as heart rhythm changes with verapamil or thyroid and kidney function with lithium. In summary, managing cluster headaches involves a combination of rapid relief methods like oxygen and triptans, along with preventive medications such as verapamil, lithium, and corticosteroids to reduce the frequency of future attacks. The choice of medications will depend on individual headache patterns, severity, and medical history.